Hello, and welcome back to part 3 of A Case of the Troubled Teen. So, to review, this case is about a 17-year-old female named Sally. When she first came into the office, she gave me a note from her dad detailing in chronological order what has been going on with her ears, including her symptoms. She also talked about being in her mom's care before and how that wasn't a healthy living situation for her. I later in the case history realized that Sally was not able to recall the order of events herself about what has been going on with her ears, so that is why her dad passed on the note. So for case history, this was from a previous case history 10 years ago. When I was looking into her history, I found that Sally had a history of otitis media and had PE tubes at one time. But at the last test 10 years ago, she had clear ears, no PE tubes, type AS in the right ear, type B with a large ear canal volume in the left ear, so she had a perforation, and she had hearing within normal limits bilaterally, no airborne gaps. SRT was consistent with PTA. After this whole case, I went back and reread her history, and I realized that I missed something. She was referred at that time to get the hearing test 10 years ago because her school needed it for an IEP. I didn't catch that right away, and sometimes you can miss those types of details when you're reviewing notes because you don't have a lot of time between patients. So that is kind of gave me an answer as to why Sally wasn't able to clearly describe her symptoms or recall the order of events. It could be something intellectual or cognitive. We're not really sure. There wasn't a diagnosis like that in her chart, but it could be a possible explanation. So to review her current symptoms when she first came in, it started with it being difficult to hear out of her ears, and then it progressed to pain in her ears, and then she said she couldn't hear out of her right ear. So her doctor started her on prednisone just in case she had a sudden hearing loss, and she was also given amoxicillin, which is an antibiotic, in case she had any ear infections. So at the initial audio evaluation with me, I had started with the case history as I normally do. I found that Sally had bilateral pain in both ears, mostly in the left ear, which is the ear that had the perforation before. I also noticed again that Sally was not able to accurately recall dates and times and describe when, the tinnitus first started. So it confirmed what I had thought before, which is she just has a very hard time with dates. And so that's why her dad had passed on the note about what has been going on. For the test battery, she had a clear ear in the right ear and then a perforation in the left ear. With tympanometry type AS in the right ear, could not seal in the left ear due to the tymp. Pure tone initially showed as profound hearing loss in the right ear and a mild hearing loss in the left ear, and could not get reliable bone conduction. So at this point, I'm thinking possibly a right sudden hearing loss and a left otitis media. And then I found that the PTA was not in good agreement with the SRT. So I had decided I've tried re-instructing, didn't work, and so I decided we need to retest before I can refer her out for some treatment. I also did the stinger. It was positive, meaning her right ear were not true thresholds, and I couldn't get reliable results, which was sad for me because that meant I could not refer her to the head and neck physicians without an accurate audiogram. So I had decided to see her again in 2 weeks. I could also see that she was in pain, so I was suspecting either an ear infection in one ear or a bilateral ear infection. One of you in the comments wrote, I would also suspect some malingering due to her current strenuous family dynamics, which I agree. You never know for sure why someone is malingering, but oftentimes it is a trend with teenagers or kids that come from troubled homes. And this is her audiogram, initially profound in the right ear and a mild hearing loss in the left ear. So 2 weeks later, I saw her again. This time the right ear looked a little bit more red, type B, TIMPs in both ears. And I was able to get accurate pure tone thresholds, but still I could not obtain masked bone conduction. There was still a perforation in the left ear, and the right ear also looked red, so possibly a bilateral otitis media. So here is the audiogram. So this ruled out the sudden hearing loss in the right ear. It was not a true sudden. It is mild in both ears and conductive. I was not able to get reliable masked bone conduction thresholds. My suspicion is that the patient just was not understanding the instructions. She wasn't able to ignore the masking noise and press the button for the beeps, so she wasn't able to complete the task. My questions were, what do you think is going on with this patient? As we talked about, initially she presented with a sudden hearing loss, which was not true. She was malingering the first time. The second time she was more honest. We couldn't get reliable bone conduction. My suspicion is she just was not understanding the instructions and therefore was not able to complete it. She did not have a true right sudden hearing loss. The diagnosis is bilateral otitis media, which all of you guessed. And the treatment would be antibiotics and referring her out for medical treatment with either a head and neck physician or her primary care. Because this is a pediatric patient with a perforation, I would refer her to the head and neck specialists, which one of you also wrote that you would do the same thing, refer to ENT to medically assess her ears. Thank you for following along. I hope you enjoyed this presentation. All of the comments were right on the dot. You guys guessed everything correctly, so good work.